Hi guys, welcome to New Age. Thank you for visiting our website. A tummy tuck is a type of surgical procedure that we do to give someone a flat stomach. There's different types of tummy tuck operations. They're also called abdominoplasties. And what we try to do is match the type of abdominoplasty for the specific patient. The smallest or most minimally involved operation is something called a mini tummy tuck. That's something where the scar basically is about from here to here. And it usually takes around an hour and a half. We often don't move the belly button. Not many people are candidates for this. Far more patients are candidates for what's called a traditional abdominoplasty, so a slightly longer scar. The scar goes from hip to hip, and there's also a scar around the belly button as well. There are times when we have to do liposuction at the same time. This is called a lipoabdominoplasty or a tummy tuck with liposuction. And there's also one other type of procedure done called a fleur-de-lis abdominoplasty. This is an operation where someone has so much extra skin that a traditional abdominoplasty would not be able to deal with it all. So instead of the scar here, they have that scar, but there's also a scar from here, this is called the xiphoid, straight down. We only do this in people who really need it, so like someone who's gone through a massive weight loss. The surgeries generally take around 2 to 3 hours, depending on what needs to be done. These are all typically done on an outpatient basis. When patients wake up, there's a bandage on their stomach, and there's also a binder. The binder's worn for 4 weeks, but the bandage comes off at 1 week. Surprisingly, this does not seem to be a particularly painful operation from what I hear from my patients. I always call people the day after just to check in and see how they're doing. Most people are surprised that it's not more painful than they anticipated. A lot of my patients who have these operations have also had things like C-sections or hysterectomies, and almost everyone says this is much easier than either of those operations. The whole point of this operation is to give someone a flat stomach, and so what we're doing is we're removing extra skin, removing any extra fat with liposuction as needed, and we are fixing the core muscles if that's something we need to do. And so this is something we often will need to do if someone's been pregnant before. If you're interested in learning more about tummy tuck surgery or abdominoplasty surgery, please scroll down to the bottom of the page. There's an area where you can book a consult with me, and I'd be happy to talk to you and talk about your options.